You're going to connect the tube from the patient to the collection device, okay? And then you are going to turn your suction canister on the wall to 80, at least 80. It may be higher, okay? It's going to be dependent on what? Facility policy or your physician's order, right? Okay. And then you want to connect your suction tubing to the suction port. So you're going to connect it to the suction port. And once you do that, you should start seeing immediate bubbling in this area right here, okay, in your bubbling chamber, okay? Another thing that you might see is this line right here there's a ball in there, and as your patient breathes in and out, this ball will fluctuate. And it's not uncommon for it to fluctuate between 5 and 10 centimeters, okay? So it's not uncommon for that ball to float up and down, okay? Now this constant bubbling that's happening in our chamber here will start to dissipate, and it'll be just an intermittent bubbling after a while, after the chest tube has been in for a little while, okay? So that's going to be one of the things that you monitor when you're looking at this, okay? So constant bubbling when you first put it on, intermittent as it continues. Now you may have to fluctuate the suction in the container itself. And how do you do that? You do that right on the side, okay? And it should be at a 20. But then again, you may have to fluctuate it in order to get this bubbling to stop. So you would do this by, just turning it. So this is 10, this is 15, this is negative 20, negative 25, negative 30, negative 35, negative 40. Got it? Okay. And you just do it right here. This is how you turn it right here. Okay? It's always set at 20. So then we are sure that that's all done, and we do that down here beside the bed, not up here where I'm holding it, okay, because that's above the site, right? We always want it below the site, okay? Never above the patient, okay? So we want to hang it on the side of the bed, make sure that our tubing is not coiled up, okay? All right? We want to tape all of our connections. So we would have put tape here. Okay, why? Because we don't ever want that to come apart. So we usually tape it. Okay? All right. And then at that point, we would clean up our mess and our physician's mess. So we take all this away, right? We take it all away. We would redress our patient. We would make sure that they, know about the chest tube, the pain level, what's their pain, how are they doing, be cognizant of that tube right there, so they may not want to put their arm down a whole lot, right? We're going to reposition them in the bed to comfort. We're going to lower the bed, okay? When all of that is done, we're going to ask the patient to take a deep breath and hold it for a few seconds and then slowly exhale, okay? And we're going to see how that handles in the system, okay? Prepare the client. We want to make sure that we prepare them for a chest x-ray to check for placement of the tube in the lung expansion. Once we put that chest tube in, they should start feeling relief in that side of the lung that it was in. So we want to get chest x-ray in there to verify that we've actually got the tube in the correct place and that the lung is actually expanding the way it should, okay? We're going to always ensure client safety. How are we going to do that? Well, we're going to monitor for intactness of the closed chest drainage system. We're always going to keep a 250 milliliter bottle of sterile water at the bedside at all times of somebody that has a chest tube in, okay? And we're also going to keep a sterile occlusive dressing like the gauze dressing that I showed you, okay? We definitely want to have the gauze dressing here. Remember this? The gauze dressing, okay? and in case there's a breach in the system. Okay, I'll talk about that in just a moment. You're going to assess the client for signs of new or worsening pneumothorax. They're going to show that it's worsening. You guys, I'm sure, have seen it. Can't breathe, become anxious, blue around the lips, SATs drop, heart rate goes up, heart rate goes up. You know, these are all signs of it worsening, okay? You're going to assess the client for signs of subcutaneous emphysema. What is that? Well, that is air accumulating right underneath the skin. And it sounds like Rice Krispies, okay? You're going to palpate around the dressing site for crackling indicative of subcutaneous emphysema. So you're literally just going to palpate. You're just going to feel, okay? And you'll be able to feel it. You're going to assess the drainage and vital signs every 15 minutes for the first hour. You're going to mark the collection chamber at with a line, a date, and a time. Okay, so what's that saying is you're going to take this chamber and you're going to write, let's say that the level is at 50. You're going to draw a line right here beside it. You're going to put your initials in the time and the date, saying that at that time, that's what the fluid was at. Okay? You're going to report bleeding or drainage greater than 100 milliliters an hour to your physician. All right? And you're going to document the procedure, the assessments, and the client's response. So that's it. That's assisting with a chest tube insertion. Okay? That's skill 13.20.